And now let's point and laugh at this week's
Idiot Extraordinaire.
And this week it goes to all the drug warriors and other busybodies trying to oppress pain sufferers with the bogus opioid scare, which we've covered quite a few times on this podcast, and I think you were here for one of those, Chris.
Oh, yeah.
Well, the problem, of course, is all of those horrible, evil doctors prescribing them, and if we just stop that, everything will be all better.
Yeah.
Except a report from the IQVIA Institute for Human Data Science. Opioid prescriptions, which had been continually rising up to 2011, began falling at that time, and they fallen a total of 29% between 2011 and 2017. And guess what? That's the same time as opioid-related deaths began accelerating. They'd been rising steady up to that point, basically like a linear, but after that point, they started rising exponentially.
It actually reminds me of this funny thing that was making fun of war, where it shows a senator banning opioids, and then he later reads, people are dying from black market opioids, and he's like, God damn it, how come every time us good, well-intentioned politicians pass a law, the black market has to come around and ruin it?
But even when you take out heroin and fentanyl and just look at synthetic opioids, before 2011, they'd been rising maybe a tiny bit, but was fairly flat. They accelerated big time around the time prescription opioids were moved to Schedule II. Gee, thanks, Barry. And Trump seems bent on continuing the same misguided policy.
Yes, there are people who are legitimately addicted to opioids, but addiction is a symptom of a much greater problem, and by banning the drug, you're only putting a bandage over one of the symptoms, and you're not treating the other problem, because even if the person who's addicted decides, I'm going to give up taking opioids, he's just going to substitute his addiction with something else.
Well, yeah, but in addition to sending them to the black market, and I mean, pain is a huge motivator in that regard, pretty much any psychiatrist or psychologist will tell you that if you're trying to figure out someone's risk for suicide, consider their pain levels.
Oh, yeah.
Yeah, I mean, and there have been people who have lost their opioids trying to deal with chronic pain. They haven't been able to deal with it without it, and they've committed suicide. Well, and the opioids don't get you out of pain completely. They just take it down to a level where you can just kind of muddle through the day. So what do drug warriors like all statists do when their policy is shown to be completely and utterly not working and even backfiring? Well, they double down, of course. We're obviously not doing enough.
Yep.
And the patient died because we didn't use enough leeches.
Yeah, I mean, it's like, what? The bailouts didn't save the money and many companies went out of business and stopped lending? Well, that's because we didn't give them enough money.
Yes, the DEA has reduced the number of prescription opioids that can be produced by 25% last year and another 20% this year, and they've announced plans to restrict it even further. And they claim that this is based on legitimate medical needs of patients, not the number of pills expected to sell, but the number expected to sell is based on the number of expected prescriptions, and that, in turn, is based on patients' legitimate medical needs.
Actually, that reminds me of that one guy who was in a similar situation that you had that one time. He was in a terrible car accident, only he was actually in a wheelchair because he was in so much pain and he was partially paralyzed, and the DEA raided his house, pointed guns at his children and all that, and arrested him, and they said, well, he had too many pills. We found over 40 or 50 pills, but then several doctors pointed out, that's about a basic week and a half's worth of prescription.
Yeah, I get them filled 90 at a time. But this is what government always does in both healthcare and the drug war. They substitute their own judgment in place of licensed and qualified medical professionals who have actually examined the patient in person. If anyone else did that, it would be practicing medicine without a license. But for government, it's all in a day's work.
And that's also a reason why healthcare is so expensive and why people are having difficulty finding doctors these days. It's because it's so freaking difficult to become one these days, And I actually read somewhere that, there was one medical student who said the worst part about going to medical school isn't, learning all the complicated disease terms and all that. It's actually taking the courses where they teach you just how to deal with government regulation and how to protect yourself from legal trouble.
Well, ask anyone who's on Medicare or Medicaid how difficult it is to find someone who can treat them for something.
That's why I don't believe for a single second that you say we only care about the rights of the patient, because you don't.
So all of that makes the DEA and other drug warriors this week's
Idiot Extraordinaire.